Welcome to Lifestyle Med with Dr. Jade. Health, it's a lifestyle.
Hey family, and welcome back to Lifestyle Med with Dr. Jade. Today we have a highly requested video. If you haven't checked out my birth control 101 video yet, check that out because this is a continuation of that video. I got so many questions from you guys, which I love. And a popular question was, please do a video more in depth about specifically the birth control pill. So that's what this video is dedicated to today. We will go more in depth about the birth control pill. Are you new here? Then welcome. Welcome to the fam. I'm Dr. Jade. I'm a family medicine physician resident, and on this channel, we talk all about fitness, nutrition, primary care hot topics, and just being inspirational, sharing positive vibes. If you're into that, peruse the channel, take a look around, and join the fam. Hit the like button on this video and the subscribe with the bell so you never miss a video when we upload every Wednesday on Wellness Wednesdays. All right, let's get into the video. The 5 things I want to cover on this video is how effective are birth control, what are the advantages of the birth control pill, we're talking about the pill here, and who should not be on birth control pills, what are some side effects of birth control, and I also want to cover some of you all's commonly asked questions at the end. I think I had about 4 or 5 that a few people asked, and I want to just touch on those as well. So first thing we want to cover is how effective are birth control pills. And 8 in every 100 women in research that use the birth control pill still get pregnant. So about 8%. And that 8 in every 100 women that is getting pregnant on the birth control pill, a high percentage of those women just have some user error, either forget to take the pill, skip the pill, and I do have tips that I give to my patients to help them remember to take their birth control pill every day and at the same time. So if you're interested in a video like that, let me know. The next thing I wanted to talk about is some advantages of the birth control pill. First of all, it's easy to start taking it. You get a prescription from your doctor and you can just start that same day. Now, your doctor may recommend different times of the month to start taking the birth control pill, but the whole point is that it's easy to start and easy to stop. When you don't want to take the pill anymore, you stop and it stops working. It stops working. The good thing is if you want to get pregnant right away or you have a specific date where you want to start trying to conceive, you can stop the birth control pill and you can get pregnant when you stop using the birth control pill. Another advantage to birth control pills is there are several other forms of reasons that you can take birth control pills that help with other health issues. And I will be doing a whole separate video on that because I did get requests on, well, what are these other, things that birth control pills can help with? I got some requests on that. So I will do a separate video on that. The next thing I want to cover is how birth control pills work. So what birth control pills are doing is they are preventing or suppressing ovulation, which is that luteinizing hormone or LH hormone spike, which causes our egg to release and implant into the uterus. That is the step that we are preventing or suppressing while on birth control pills. The estrogen component in birth control pills helps to prevent new follicles, which hold the egg, okay? They prevent that from developing within our ovaries. And by giving the progesterone in the birth control pill, that helps to keep the uterine lining thin, because to have the egg implant into the wall of the uterus, we need a nice thick wall so that the egg can implant there so that the baby can grow. But if we're giving progesterone in the form of a pill, it helps to keep that wall thin so baby doesn't have a place to implant, and it also helps to keep the mucus within our cervix or within the vaginal flora or within our vagina near the cervix. It keeps a nice thick mucus in that environment, okay? Which creates a barrier where the sperm have a hard time getting through to the uterus. Next, we will cover who should not be on birth control. And this is the thing that I feel like I talk about most in my clinic. And the CDC has a list of unacceptable health risks that we look at to make sure that if you have any of these health risks, then birth control pills are not recommended and we should explore other contraception options. So the first unacceptable health risk that the CDC talks about where you should not be on birth control pills is if you are over 35 years old and a tobacco user. Hypertension is another unacceptable health risk that if you have high blood pressure, and specifically they talk about blood pressures that typically run with a systolic or upper, the number that's on top for the blood pressure reading of 160 or more, or the diastolic or bottom number in the blood pressure reading of 100 or more. Basically, long story short, if you have high blood pressure, chronic high blood pressure or hypertension, then birth control pills are not recommended. If you have a history of deep vein thrombosis or pulmonary embolism, which are basically clots in the legs or lungs, or if you have a family medical history of clots in the legs or lungs, it's also not recommended for you to be on birth control pills. Also, if you have a history of heart disease or a history of stroke, also not recommended for you to be on birth control pills. And in addition to that, if you have any severe liver disease, such as, it's not recommended for women who have breast cancer to be on birth control pills. If you have diabetes, specifically diabetes, type 2 diabetes or type 1 diabetes, where you have had diabetes for more than 20 years, the CDC says you should not be on birth control pills. Or if you have a history of migraines with an aura, this is a big one because we have a lot of patients who have a history of migraines and they ask if it's okay for them to take birth control pills. The CDC specifically talks about migraines with an aura. An aura is often described as like a sensation that people that often get migraines or severe debilitating headaches, they get a sensation before their migraine. So sometimes this is a visual sensation. Some people may say that they can see like lights twinkling. And the last unacceptable health risk listed on the CDC for people who should not be on birth control pills is basically people who have a combo platter of these things. If you're over 35 and you're a smoker and you have diabetes, not recommended for you to be on birth control pills. So next, what are the side effects of birth control pills? First, I'm going to talk about the common side effects of birth control. So some common side effects of birth control pills can be some mood swings or moodiness or irritability. It can be some nausea, vomiting, bloating. These things typically resolve or improve after or within 3 months of using birth control pills. So if I have patients that say that they're very nauseous when taking birth control pills, then we'll, suggest for them to eat, take it with food instead of on an empty stomach. And again, these typically improve within 3 months and are typically mild and get better with time. Some women also get some breast tenderness. Again, this also typically resolves within 3 months. Now, I want to bust a myth here. Birth control pills, in research, birth control pills, there is no evidence of weight gain with birth control pills. When it comes to contraception, women want to often know what will make me gain weight. Birth control pills are not shown in research to make you gain weight. Two of the other side effects that we talk about with birth control pills is increasing that risk of there is an increase in risk of clotting in the legs or lungs, which is called a DVT or a deep vein thrombosis or pulmonary embolism. There's a slightly increased risk, and you're going to have a higher risk of this happening if you, one, have a family history of clots like we talked about, and also if you are overweight or obese, that's also going to increase your risk. And if you're over 35 or you're a tobacco user, all of those things are going to increase the risk of you getting clots on birth control pills. There's also a slight increase in blood pressure that has been shown in research, especially with people with hypertension or diagnosed high blood pressure. So, and studies have shown that it increases that systolic blood pressure or the top number of your blood pressure reading about 3 to 5 points. So cervical and breast cancer risk increase is actually debated and controversial in medical research. So some research literature says that there is a slight increase in risk of these cancers, while others don't find that to be the case. So this is a debated topic that isn't conclusive in our medical research at this time. However, there is a clear decreased risk in endometrial and ovarian cancer in medical research. And I want to end this video by please still use condoms. If you are using birth control pills, They do not prevent sexually transmitted infections or STIs. And so next I'm going to be referring down in my notes. I just want to address some of the questions, the commonly asked questions that I got from you guys in the comments after seeing my birth control 101 video. So the first one was, what age should you stop using birth control pills? And so we kind of touched on this already. It's not a specific age cutoff where you hit this age, you should stop taking birth control pills. It's more so as you get older, the estrogen risk and the cancer risk that is debated in research that we talked about. It's just, when you hit over 35, we want to start exploring how much longer do you want to be on birth control pills? Are there other options that would be better for you? The next question that I was asked quite a bit was the difference between estrogen and progesterone and the birth control pill. And I covered that at the top of the video. So let me know if you still have questions on that. I think I addressed that one for you. The next question I had was, should you check your hormones? And no, it's not recommended for your hormones to be checked. If you're not having any specific health problems that would warrant us to check your hormones, then it's not necessary. Women don't have to check their hormones often, and if you come in with certain health complaints, then we may do some blood work. It probably won't be checking your estrogen or progesterone, but we may do some other blood work to rule out other medical problems. But you do not need to check hormones. That's not something that you have to worry about doing. The next question I was asked was the side effects or adverse effects of birth control pills. I hope all those were addressed for you in this video. They should have been. And the last thing was, I was asked who should not be on birth control pills, which we also already talked about in this video. So I hope I answered your questions. If you guys think of any other questions you have regarding birth control pills, contraception, women's health, sexual health, I am happy to talk about those. Leave me a comment. Join our family on Instagram at DrJadeMD. Lots of these questions were also submitted on our Instagram. I'm interacting with you guys there and here. I read all the comments and I will respond back or make a video on it. I'm here for you guys, and I will see you next week on Wellness Wednesday. If this video was content that you enjoyed and found helpful, please let me know in the form of a like, and hit the subscribe, join our family, share these videos with a friend that you think would benefit and be interested in health, fitness, nutrition, primary care, hot topics, and I'll see you next week. Bye.
Be sure to like, comment, share, and subscribe. Thank you, and God bless.